Hi, I'm Lisa Prather, and welcome to The Voice of Health with our host, Dr. Robert Prather of the Prather Practice, where lives are changed every day through the natural approach to healthcare. Well, today we're talking about for the Olympian in you, and it is that the Olympics are on, the 2016 Olympics, and we were up late watching swimming. The Phelps guy is on for his fourth gold. Well, what is meant by the Olympian in you?
Well, what we mean by that is that, all of us can imagine ourselves, running for the gold or swimming for the gold or whatever, doing for the gold.
I want to sprint.
You want to sprint? Okay. And we all do our little sports thing. We do our golf, tennis, frisbee golf, whatever it might be, with the idea of the crowds cheering and everything's kind of, coming together. Mm-hmm. And one of the biggest things that as you're going through the Olympics, people talk about this and that, and they go through their injuries. Well, they weren't able to compete, last 4 years because of this injury or that injury, and that's a really big thing. Is just thinking about this is the sports injuries. Mm-hmm. That right now people are real active with the nice warm weather, and people are coming in with sports injuries, and that's one of the biggest things that is the fear of an Olympian, is that they'll get hurt and not be able to compete. Mm-hmm. Matter of fact, one of the things that is very evident, especially with the swimmers as we were watching them, is they had those little round bruises all over them. Yeah. Michael Phelps was doing that.
Big hickeys.
Yeah. And of course, what they're doing on that is either treating sports injuries or trying to prevent sports injuries.
Mm-hmm. There was cupping, and they did a whole thing on it, explaining cupping, which is interesting.
But there's a lot of other different types of treatments that they are experiencing in the back. That's just an evidence of one. Uh-huh. And, one of the most important things that the athletes consider is who's treating them. And who's treating them on a regular basis. Mm-hmm. Because the only way that they can continue to perform at the level that they do is that they're able to avoid and get those sports injuries treated right away. Mm-hmm. So this would be a rather opportune time to talk about sports injuries.
Right. And, Tom Brady came out and said he couldn't do what he does and play as long as he has in the NFL without his chiropractor.
Correct.
So, how common are sports injuries?
Well, sports injuries are extremely common. If you've been in sports for any length of time, you're going to get some type of injury. Matter of fact, there isn't one Olympian who hasn't had a injury in their chosen sport. Mm-hmm. So it's pretty well guaranteed, if you're doing something on a regular basis, that there can be an injury involved in that. So, what do you do about that? How do you actually approach that? What are the avenues that you have? And also, what should you do along those lines?
Mm-hmm. So, when should you seek treatment for an injury?
As soon as possible.
Uh-huh. Yeah. The people that wait and it's going to take care of itself, or
right. One of the things that is interesting is that the athletes, usually after almost every performance or every training, is they just get checked right away. If you can get the beginning of a sports injury before it becomes actually a major problem, that's actually the best way. Mm-hmm. So many of the athletes are right there in the training room afterwards, getting checked to make sure that everything's working properly. It's sort of, when you're thinking about, an Olympic athlete, it's sort of like a race car. Mm-hmm. A race car, every few laps they check it.
That's true.
Right. And then they check it. They do a thorough type of check every time you take them out on a spin. The mechanic's right there checking everything right afterwards. Mm-hmm. Well, when you're talking about an Olympian, that's how they operate.
What about us?
That's also a good thing, when we've got the old family sedan who's going back and forth from work, and we should be proud of that. We still have sort of regular checkups, to maintain the function of the car. Make
Yours
sure that
is
it's
a sedan, mine's a Ford Mustang.
There you go.
Convertible.
There you go. So, we've got different speeds that we all go at, and we all have different types of sports. But having regular checkups is something that I actually tell the people who are in sports, that this is something to come in, and get that regularly checked. I have young kids who are athletes in high school, and football players and soccer players and gymnasts and all these different types of kids. And I say, depending on kind of what their build is and what kind of prior injuries they have, about how often that they should probably just come in and get checked. And that prevention would actually help with the major traumas, that would actually keep those from occurring.
Right.
Because the things go out a little bit, or get off track a little bit, or not working quite right, and I'm just going to let that go, and then you actually, those accumulations usually wind up with that major sports trauma.
Right.
There's usually something that's actually building that up before. But if you do have something that occurs that is a problem, the quicker you can get it treated, the better the results. That's absolutely true.
Yeah, and sometimes people will keep walking on a foot or with foot pain and end up, there was a fracture.
Sure.
So...
Yeah, there could be something major, and the more that you use it after an injury, the more damage that actually occurs, and the more damage that actually occurs, the longer and harder it is to get it back to its original function.
So how can injuries be prevented?
Well, one thing is that, when you're talking about that, making sure that things are lined up correctly. If your knee has bent in even before you get a sprain or a ligament tear or meniscus tear, there's usually some type of misalignment that occurs. There can be a misalignment in the neck, a misalignment in the shoulders. So making sure that you have things lined up is a very important part of.
There comes the cars again. We get our cars aligned.
We get our cars aligned, because if the cars aren't aligned properly, then if the wheels aren't balanced, then you start to get wear and tear, and that actually winds up to be a major problem. So making sure that all that, making sure that the muscles aren't tight, stretching out, that's a very important part. If you get some spasms in a muscle that just aren't releasing and you keep on working it, well, eventually you're going to have an injury to that muscle.
Right.
And that spasm is usually what occurs first. Oftentimes they're kicked off by little trigger points in there that can be worked out. That's one of the things that I know the swimmers all get very thoroughly checked, make sure there aren't any trigger points in through the muscles, as they're working them, because if those are left untreated and kept from being eliminated, then those will eventually wind up to be an injury.
So who should a person seek first for a sports injury?
Well, that's a really good question, and one of the things that it's just like if you have a back problem, and you go to an orthopedic surgeon first. The chances of you getting a surgery wind up to be about 30%. The statistics also show that if you go to a chiropractor first, the chances of winding up that you're going to have a surgery is 2%.
2%, wow.
2%. So, it's again, what the first step of care, and really what we're trying to build within the healthcare community and also within the patient's mind, is to first go to a structure function doctor. And that's true of anything, especially with sports injuries. So if you can go to a structure function doctor who first looks at balancing and bringing the body back into homeostasis, both in a structural, either a skeletal muscle type of a balance, or also bringing in the body back into a functional mode, that's really the first step. Make sure that those things are in line. A good structure function doctor knows then when to refer for disease care, which is surgery or pharmaceuticals, but you should always try the least invasive means of any type of a care that is possible. You don't go right to the
surgeon.
To the surgeon, go to the pharmaceuticals right away. That should be something that's done later.
And, let's talk about, because we see a lot of people with sports injury. We didn't even mention golfers,
Sure.
Why is the Prather Practice uniquely able to handle sports injuries?
Well, we have a team. That's one of the nice things that we have along those lines. So we pretty well cover all the aspects of structure function care. We have the chiropractic. We have a Dr. Gherkin, who's also, her undergraduate was in athletic training. She is very familiar and certified in all the different types of sports chiropractic. So, she has a unique background along those lines. We have exercise physiology. We have a whole, we have the rehab. We have massage therapy. We can also deal with the functional portion. In other words, we're uniquely qualified because we have so many different types of options that can be utilized in someone's care pretty much from A to Z. Pretty much everything that's there for the Olympians in structure function care, we actually have it in spades here. So it's a complete type of a system.
So when we come back, let's talk more about those services here at the Prather Practice that can help with sports injuries. This is for the Olympian in you. You can win a free 60-minute massage in a relaxing spa at the Prather Practice. Each month we have a drawing to give away a free massage to one of our lucky Facebook and Twitter fans. Follow us on Facebook and Twitter on our website at thevoiceofhealthradio.com. This is The Voice of Health with Dr. Robert Prather. Congratulations to Charlie, one of our Facebook followers who won a free 60-minute massage in our July drawing. The Voice of Health Wellness Tip with Dr. Robert Prather of the Prather Practice. Dr. Prather, what makes your approach and emphasis on the thyroid unique?
We look at it structure functionally, where homeostasis is what is important. And homeostasis is a balance, and there's a balance in the thyroid that should be achieved, which you can determine. And the people who have a normally balanced thyroid homeostasis is probably less than 1%.
Wow.
Of the population. There are two systems that control the rest of the body, the nervous system and then also the endocrine system. And as I tell the patients, those are the two things that we need to get fixed first. You have to have a proper functioning nervous system and a proper functioning endocrine system to be healthy. And the thyroid is sort of the workhorse of the endocrine system. And many of the problems that we see in patients once we get the thyroid balanced out, a lot of the issues start to clear up. The people who come in here, often 80% of them have had because they felt that their thyroid was a problem.
Had them checked.
Had them checked, and they were told that they were normal when...
Why is that?
They're not doing the proper blood tests. They're not reading them correctly. Doctors aren't being specific enough on what the thyroid number should be. The American Thyroid Association has said that the numbers need to be much, much tighter than what they are. There's a different type of a evaluation. There's reference range, and then there's what is a perfect homeostasis? The labs aren't there to tell you what the blood work should be. They're just saying, of the people who come in here, 50% of them have this number. Reference range has nothing to do with where you should be.
Right.
That's
I know
not
you
what it's
look way
designed.
beyond them and can tell people, and they come in, well, my doctor said, this was normal. And
And I say, no, that's not normal. I even find endocrinologists not reading lab tests properly to really understand where that should be, because when we get people into homeostasis range, their symptoms go away. That's where they go, oh, wow, I feel really great. All the different things that I was complaining about are all of a sudden now working properly, and that's because they are in the range that I tell them that they should be in.
Right.
Because those are the proper ranges that need to be there.
Schedule your appointment at the Prather Practice, 317-848-8048. That's 317-848-8048. Or learn more on our website at thevoiceofhealthradio.com. The Prather Practice, restoring hope.
And I'm feeling good.
You're listening to The Voice of Health with Dr. Robert Prather of the Prather Practice, the most comprehensive wellness center in the Midwest.
Well, we're talking today about For the Olympian in You. And Dr. Prather, before we go on to different services that can help, let's talk about what are the 10 most common sports injuries? Drum roll.
The most common sports injuries, knees are number one. What they find is, 55% of all sports injuries involve the knee. And it's pretty understandable because, we jump, run, and bounce up and down on our knees.
Yeah.
So it would be understandable why that is such a common sports injury. And that's one of the things that we are uniquely able to handle in our office to really get things, not that, at times that surgeries aren't necessary, but we really do an excellent job with that. One of the things that I can think of is I had a patient came in and was complaining about back problems. And they had been in volleyball, a college volleyball player. Finally had to quit because they had had 2 surgeries on the knees, and there was nothing really left to do on that. And I said, well, your knee's kicking off your back problem is. She said, well, there's nothing that can be done about my knees. And I said, well, why do you say that? She said, well, that's what I was told. And so for the last 15 years, we've had knee problems, which have eventually led to back problems. So what we did is, first off, is even after the surgery, there was a misalignment that was involved in that. And so the first thing I did was even though it had been surgical, I put it back into place and got up, and it was like a revelation had hit her. This was like, I can move my knee and it doesn't hurt. So, we were then able to, because she had physical therapy actually several times with no results, but if you don't put the knee back into place, proper position, the rehab doesn't work.
Right, you need both.
You need really both. So we worked with the knee, got that, rehabbed, did some acupuncture on it so that would speed up the healing. There were several things that we did, including some manual therapy on the muscles. And not only was she able to get her back fixed, but got her knee, and she said, wow, if I had this at the time, instead of going, the way that I did, I would have been able to finish up my volleyball career. So, and matter of fact, actually was thinking about getting back into volleyball, just playing it as an adult. So, when you have those types of things, that really makes a big difference. So, knees are the number one problem. Matter of fact, I had a orthopedic surgeon bring in his son because he had something called Osgood-Schlatter, which is a painful point. Basically, what happens is the muscles the knee's out of balance, the quads go into spasm and actually pull a portion of the bone loose. and so you get that bump right below the kneecap, which is the Osgood-Schlatters. And he wasn't going to be able to play sports anymore because of that. That was the normal type of thing. But he said, I've had 4 patients of yours in my office who I had said that they couldn't play sports because of the Osgood-Schlatters, and you fixed them, so can you fix my son for me? And so we got him all fixed. First I put it back in place, got that down, and he was able to resume his sports. So, as you can look at those knees, and we have a unique type of way of doing that, that really, really helps with the whole problem. So, knee injuries, 55% one of the most common things that we work
patella,
with.
the kneecap, it gets off track.
Yes.
And being able to align that.
That's actually the number one knee problem.
Is the patella.
Yeah, that patella tracking is usually one of the first things that occurs before you actually get some of the other
And
injuries.
you've talked, too, because a lot of young women in soccer have knee problems.
Oh, yeah.
You say that's kind of connected with the hips and the way the knee and the hips are aligned.
Yes, there's a very big aspect on that. Our daughter was very much into soccer, and all of her friends were having different types of injuries, and she was saying, I don't know what's wrong with everybody. Everybody's getting injured. I'm not. And one of her daughters, or one of her friends, said, well, because she had come to me too, she said, Lizzie, your dad adjusts you on a regular basis. She goes, oh yeah.
Yeah, that's what he does.
Oh yeah. Maybe that might have something to do why I never get injured, because we're proactive on the whole thing. And again, I've told several patients that who had their daughters had knee problems. And I said, just bring them in on a once-a-month type of basis. I'll make sure everything's aligned. They just won't have these injuries anymore.
Right.
So,
especially while they're playing sports.
So knee injuries with all the different types of things, making sure things are lined up, muscles are also in balance, all very important. Shoulder injuries account for 20% of all the things that go on. I've had quite a few different types of shoulder injuries. Oftentimes what I do is I get them later on in life. When they should have been in, they didn't.
Right.
And then, when they finally come in when they can't move their shoulder anymore, in their 40s or 50s or 60s. Oh yeah, when did you injure that? Well, when I was 19.
Yeah. We have a guy coming in now, a rodeo guy. He's done rodeos up until the 70s,
right.
And destroyed his shoulders.
Yes.
Yes,
and now once it fixed,
he would have. Yeah. If he would have had it maintained,
So shoulders, and we do quite a bit with that, and get some excellent results. But most of the shoulders that we deal with are people who are a little bit older, and of course they got their injury when they were 19 or something like that. And yes, we actually do get some good results along those lines. Tennis or golf elbow, 7%. So those are the 3 top ones. And I recently had a gal who came in who was not going to be able to play tennis anymore because of her elbow. She wanted to try the acupuncture first, some exercise, and we were able to get her 100% back in a short amount of time to get her back on the tennis court. So tennis, golf elbow, very common thing that we deal with. Hamstring strains, number 4. Sciatica, low back problems, number 5. Shin splints. We have had a lot of people with shin splints. We're able to very effectively get that under control. Acupuncture is amazingly helpful for that particular problem. Groin pulls, usually there's a pelvic alignment that's involved in that, why that occurs. Get that balanced out, and that works well. Number 8, concussions. We've had some very severe concussions who's come into our office that had heard about us on our ability to treat them. And not only do we do the adjustments, which are extremely helpful, but also we have some homeopathics that are specifically for concussions, and have been shown to be extremely effective. But we had one young lady who had several, was a soccer player and had several head traumas, concussion. They had the pre and post on that, and she just wasn't recovering. Finally was referred into us. We adjusted her and then started her on the homeopathic program for concussions. And not only did she heal, but she was actually better than what she was before she. In other words, she scored higher. And, the neurologist was very impressed.
Oh, from her baseline.
From her baseline. Wow. So she was actually better than what she was before. ACL tear is a big one, is number 9. And then hip flexor strain is especially for hockey players. And
low back was number 5.
Yeah, but low back, they oftentimes don't look at that as low back is a very common problem, but it's not necessarily from sports.
Okay. Well, let's talk about how is chiropractic essential for treatments of sports injuries?
Well, there are many things that have been done on patients, but oftentimes as people come in, I said, well, this is going to need some rehabilitation. You're an occupational therapist and run the rehab department.
Right.
But they said, I've been through physical therapy 4 times and it did nothing. And what I do is I say, well, you have a misalignment. So if we can get your pelvis settled, we can get your neck back on straight, we can get your knees settled into the right place, the physical therapy then will work. We've had physical therapists, you've occupational therapists, and you can, just reaffirm that there's a huge difference.
You make our job a lot easier.
Oh yeah, it's very hard to work with a joint that is out of place and actually expect to be able to just do exercises and get it working right, because it's not in the right position. Once you get it into the right position, all the exercises work amazingly well.
Right.
So, what I tell the patients is the chiropractic will make all the difference in the world on your rehab, and as you are doing the exercises this time, it will actually work, and they all say yes. This actually worked this time. And did we do anything differently than what they did before? Probably not. It's just that we had the joint in proper position.
Yeah, it's very helpful. When people are. It just makes our job so much easier when they're aligned. And
it just makes sense.
Well, what about acupuncture for sports injuries?
Acupuncture. The great thing about acupuncture is the chemical changes that take place. One, it has amazing anti-inflammatory properties. I have people who have swollen joints, knees, elbows, and I say, have someone else who's there, and I say, now, I'm going to stick these needles in, and just, you can actually watch this, and in 15 minutes, the swelling's going to be gone. And they look at it, and they're like, wow, that's amazing.
Yeah, it's amazing what it does for inflammation.
Sure, and it also speeds up healing. So when you do acupuncture, one of the things that we use acupuncture for is for scars. So people have surgical scars that have been there for years. We can put acupuncture needles in there, and the scars will go down, oftentimes disappear.
Well, I can attest to that. I had a mole removed before we met. You probably would have told me not to have that removed. It was right at the solar plexus, and it would sometimes get my diaphragm into spasm. And you have done acupuncture, and that scar, I can't even feel it.
Right.
It's amazing.
Acupuncture also stimulates healing, so you can get a much greater amount of healing with the acupuncture than if you didn't have it.
Okay. We come back more for the Olympian in you.
Listen to the Voice of Health Radio on your smartphone or tablet on all of the top radio apps available. TuneIn Radio, Stitcher, and iHeartRadio. You can find these apps and more on our website at thevoiceofhealthradio.com. This is The Voice of Health with Dr. Robert Prather. Laughter is the best medicine.
I don't get why it's okay for the doctor to be late. If I have a 2 o'clock appointment, I want the doctor looking at me at 2 o'clock. The only way I think it would be okay for the doctor to be late is if at 5 of 2, you're in the waiting room and you notice from under the door that leads to the back rooms a pool of blood. An ever-widening pool of blood coming out into the waiting room, and everyone has to lift their feet. I think we might be delayed. Then it would be okay for him to be 5 minutes late. Clamp whatever's doing that and get me back there. I want to hear a clamp noise and him saying, my 2 o'clock is here.
Are you frustrated by not getting to the root cause of your health issue? Are you tired of not knowing why you're always fatigued? Are you wanting to say no to toxic drugs? Have you lost hope? Are you just tired of being sick and tired? At the Prather Practice, we want you to know that we have the answers for you. We offer the alternative to the disease care model. We are the drug-free model to health and wellness. At the Prather Practice, we look for the underlying cause of your health problem and not just the symptomatology. Through thorough diagnostics, we find your individual health blueprint for your treatment. Where the disease care model is symptom-based, the structure-function model we practice gets to the root of your health issue. The Prather Practice is the most comprehensive wellness center in the Midwest. Our integrated practice offers you the most treatment options to restore your health and your hope. Learn more about the Prather Practice by calling 317-848-8048 or learn more on our website at the
Olympian in You. It is Olympic year 2016. In Brazil, and we've been watching it, and we're just talking about not only Olympians, but
the Olympian in us.
Yeah. I know for me, being in my 50s, I want to exercise like I'm in my 20s again. And
we forget.
We forget.
We still think, as we picture ourselves, still 20.
Right.
Funny how that works. Mm-hmm. Just seemed like yesterday.
Right. Well, we were talking about the different services here at the Prather Practice that help with sports injuries. We talked about the chiropractic and the importance of alignment of the bones. And the other day, someone was coming in for low back pain. Oh, you adjust the feet. Well, the feet have, 22 bones in them, or quite a few bones?
54 articulations.
Articulations, okay. Yes. You need your feet for a lot of sports, correct?
Yes.
We do a gait scan analysis if orthotics are needed. Mm-hmm. A lot of times people are overpronating, which does affect the knee, can affect the low back. Then we talked about acupuncture, the importance of healing, inflammation. Let's talk about kinesiotaping and how helpful we do that here.
Sure.
Dr. Gerken specializes in kinesiotaping with her athletic training background.
Yes. The kinesiotape, that's something that oftentimes you see on the volleyball court.
Yeah.
Again, it's not used as much for swimming because, of course, it is a tape. Mm-hmm. So they don't really take people on that. That's why they do the cupping on that instead. Mm-hmm. So kinesio...
I went to the sorry, I'm interrupting you, but Dancing with the Stars, and they were all taped. You could see I was in fourth row.
Oh, yes.
Yeah. So they were all taped by the shoulders, by the neck.
Dancing. Definitely a sport.
Yeah.
And a lot of injuries in that. Mm-hmm. So yes, kinesiotape, what it does is it works the muscles and keeps those trigger points from actually forming. So, you can get those worked out, put the kinesiotape on that after you work it. And it's excellent not only to treat a sports injury so that you don't re-injure it, but also they use it as a preventative. Mm-hmm. So if you have a tight muscle that they've just worked on, usually they will do some kinesiotape on that And what that does is these fibers in there actually continue to work the muscles as it's going back and forth. So there's trigger points, and let me explain what a trigger point is. It's basically a muscle spindle that has gone into spasm.
Okay.
And as that muscle spindle has gone into spasm in the muscle, then that prevents that muscle from working completely properly. So if a muscle's not working right, it's much, much easier to get a injury associated with that. Mm-hmm. So the kinesiotape is an excellent way of working a muscle that's been injured and also preventing a muscle from becoming injured again. So something that is used very, very often in any type of a sports situation. Mm-hmm. So we do quite a bit of that here.
Yes. Now we have something called rapid release. It's actually an instrument, and it's kind of a new revolution in sports injury.
It is.
We're even using it someone who had back surgery 20 years ago and the scar tissue that's built up. It's really helped with even breaking scar tissue.
The rapid release has just taken the sports world by storm. It is something that I know the football teams, the first one that used it, said that it was one of the major reasons that they had an edge over some of the other teams. Mm-hmm. But it is basically replaces what they would use instead of that is they would scrape the muscle. So they would take an instrument and then actually scrape it along there, which really, really, really hurt. Mm-hmm. But then you could actually work that and get that muscle to release. But, basically it was pain and torture. The rapid release is an instrument that goes in there and sets a vibrational tone on that not only does what the scraping used to do, but actually does it better. Mm-hmm. So you get better results. Instead of people screaming, they kind of drool.
Yeah, they do.
It's like, oh, please do that again. Mm-hmm. Instead of, oh, please, I know I need it, but don't do that again.
We have 2 of those, and a waiting list for when we get new ones for those.
So it's a very popular type of a instrument. Warren Hammer, who is a good friend of mine, he's actually been in at our office, and I've treated him before. But Warren Hammer is probably the soft tissue expert in the world, and he has just really embraced that rapid release. He has a whole new system of treatments that are based upon that. He said, as the expert, it's probably one of the greatest revolutions in soft tissue treatment. Something that we were on almost immediately as soon as it came out. Mm-hmm. It was invented by a chiropractor. Warren Hammer is also a chiropractor and is acknowledged as his textbook is the textbook for soft tissue injuries. So it is a fantastic type of a addition to our program and something that sports teams now have on hand. It is probably not in the high schools or has gone down to that level, just now hitting the college level, but it is something that just can make an incredible difference in any type of sports injury type of treatment.
Well, what other treatments are available at the Prather Practice for sports injury?
Well, there are a ton of those. We do trigger point injections for those that are a little bit difficult to release. Many of them actually get released from the other, but we do make sure that those are all completely cleared out. We also have ultrasound. We have many different types of electrical stim that are available. We have about 5 different forms of that we can do within our office. We also have liniments, many different types of liniments that we can use depending on the particular problem to help to work with that. And then, of course, as we are doing that, there not only is along those lines, but we have the whole functional side too. Mm-hmm. Where we can get into.
Yeah, and let's talk about that. What role does nutrition play in sports? We have a nutritionist here that works with our with people on specific diet and nutrition. elaborate a little bit on that, Dr. Prather.
Well, nutrition can play a very big part. One of the things that we did is we had a young lady who came in who was having chronic problems. She was having a lot of fatigue, but having quite a few injuries. She was plagued with them. And I not only was treating her injuries, but I also said, well, let's do some blood work on her. And she was at a level of her iron level that basically, she qualified for a blood transfusion. So when you are low on your iron, you're going to have more injuries. The muscles are going to go into spasm because they don't have enough oxygen, and there was just one injury after another on that. So not only do we look at the structure portion, where we're working with the muscles, tendons, ligaments, bones, but we're also looking at the functional, the physiology of the body. There can be many things that nutritionally can be playing a role in injuries that need to be addressed. So having that availability, we can get to oftentimes the underlying problem that's kicking off the injuries in the first place.
Right.
Especially with chronic types of problems. When you're talking about young women who are in sports, it's a strain on the body, and they are utilizing an awful lot of nutrients, and about 95% of all young ladies who are in sports are iron deficient.
95%.
95%.
Wow.
And it does affect their performance. It affects how many injuries they have. There are other nutritional deficiencies that could be occurring. Your magnesium can be off, your calcium, the minerals can play an absolute huge role along those lines. But, not only are we doing the physical in here, but we're also doing the internal.
And Ken, the challenge of the sport, you have seen some mineral deficiency, especially long-distance runners.
Absolutely.
Hard on the body.
I had a triathlete come in and said, he had just started out later on in life that, he was a triathlete and knew that he was healthy and, all these types of things. And I said, well, when you're doing a major sport like that, that actually causes a lot of nutritional deficiencies. A good athlete knows, but just because they are an athlete, that there are greater demands on the body and that those need to be supplemented and taken care of. And if you don't, that can cause long-term health issues. So I said, let's take a look at this. And basically, I saw a huge amount of problems, mainly caused because of the extra strain on his body. And I said, you're in trouble. You need to actually deal with that. And he didn't really believe me because he thought just because he was doing sports that made him healthy.
Right.
And all the Olympians know that the sports make them fit, do have health benefits, but it also has health consequences.
Right.
So if you are into very heavily into a sport, you actually need extra nutritional work to prevent nutritional deficiencies, which can actually lead to not only health issues, but also injuries too.
Yeah, because you'll hear about that. Someone's out there playing tennis and had a heart attack.
Absolutely.
Well, we have just a few seconds left. Dr. Prather, I want to ask this. Is it ever too late to treat an old injury?
No. We've had people, I actually had a gentleman who was who wanted to get back out there and dance, but he had actually injuries back in college. But he was in his 90s. And we actually treated his injuries, and he actually had a full recovery and was able to start dancing again.
Yeah, and then this week we found out we have another patient, 86, just started his first weightlifting competition.
Right.
He did awesome, which is exciting. So thank you, Dr. Prather, for the Olympian in you.
Up next, you'll hear from Nancy and how her health has been transformed after just 6 days as a patient at the Prather Practice. Never miss an episode of The Voice of Health so that you can stay informed and empowered about your health. Get a podcast of our show automatically delivered to you every week by signing up for our show on iTunes. You can find that link on our website at thevoiceofhealthradio.com. And don't forget, thevoiceofhealthradio.com has complete archives of all of our past episodes with an audio library of information to help you add more life to your years and more years to your life. This is The Voice of Health with Dr. Robert Prather. The Voice of Health Wellness Tip with Dr. Robert Prather of the Prather Practice. What conditions can be helped with acupuncture?
The World Health Organization has actually done some definite research. Also, the National Institute of Health has done quite a bit of research on acupuncture with quite a bit of very strong evidence on what it works for and what it doesn't. If we take the digestive area, abdominal pain. I have a lot of people with severe abdominal pain. We can put the needles in. Oftentimes there's immediate results. Constipation or diarrhea, we can get some changes along those lines. The reflux has some very, very good results on that. Emotionally, I have a lot of people coming in for anxiety or depression. Insomnia, I have had patients who were, who even after the first treatment that night, they actually were able to sleep. One gal said, I haven't slept in a couple of days, Put the needles in. She fell asleep on the table. And she said, wow. Infertility is a very common type of thing with a lot of research on.
We have a lot of people coming in for
very high success rate for that. But there are very definite points that affect fertility that are very important to know. It's just not that you're going into an acupuncturist. He's randomly putting some needles in. You have to know where those points are, how they're affected, be able to evaluate them, see which ones are off, and how you can actually make an effect on the body to actually increase the fertility rate.
Have you had success with
getting
infertility?
Women pregnant?
Yeah.
I don't know if that's the best way to put it.
Right.
No, very definitely. We have a very high success rate with women with infertility. We have several proud moms who are also coming in for after the birth, just to help to relax because it helped them so much. One, to get pregnant. During the pregnancy, help to control the pain, nausea, all those types of things. And then afterwards, it's a very trying type of time and find that the acupuncture is very helpful at that time. But a very, very good success rate. I'm probably saying it's almost 80%.
Wow.
Which is really, really good. So we're very proud of that and glad to help women in that struggle.
Find out if acupuncture is right for you. Schedule your appointment at the Prather Practice, 317-848-8048. That's 317-848-8048. Or learn more on our website at thevoiceofhealthradio.com. The Prather Practice, restoring hope.
It's a beautiful day. Sky falls, you feel like it's a beautiful day. So let it get away.
You're listening to The Voice of Health with Dr. Robert Prather of the Prather Practice, where our mission is restoring hope to our patients. For our Restoring Hope segment this week, we now go to Elaine Reisner with another patient success story from the Prather Practice.
We are joined by Nancy to share her story at the Prather Practice. Nancy, what health situation first brought you here to the Prather Practice?
Well, when I first came here, my back was very sore and my neck, and a friend referred me, and that's why I first came. But then I found out that there were a lot of other services that could really help my health.
Great. Before you came here, had you tried other options? Had you seen other doctors? And if so, what were those results of seeing those doctors?
Oh my goodness. I cannot count, I can't count on both hands how many specialists I've been to. Not only with my back, but mainly with my health issues, my chronic fatigue, my chronic infections. I had 3 sinus surgeries. I'm on allergy drops. I had ear tubes 3 times, and I had mastoiditis and mastoidectomies, and I've had major surgeries. And I still kept getting ear infections, and then I started getting kidney infections, and I was really sick, and it was affecting my life and my work and my career.
Gotcha. What kind of treatments did you receive here? What were the results? Now, I know that you are kind of in the midst of your treatment so far, which is awesome. So kind of share, what you've had done so far and how things have progressed.
Well, the first thing Dr. Prather did was fix my neck. I mean, he's an amazing practitioner. And the first thing he did, I didn't even know I had a pinched nerve in my neck, and he fixed it the first time. And it was amazing. I could move my neck for the first time in years, and when I turn, when I drive. And then we start talking about my other health issues, and he suggested having me having some other tests, and I did. And I saw the nurse practitioner, and I had some other tests done, some blood tests, and some other tests to find out what exactly was going on, because I was really sick. I was really, really sick. And my husband was worried, and I was losing my life. I was sleeping through the weekends just to get through my week. My life was going by me, and I didn't know what else to do. No doctors could help me. All they kept doing was putting me on antibiotics. So that's
kind of like a Band-Aid. We're not getting to the root of the issue.
It was awful. It was awful. And the more antibiotics I got, the sicker I got. And all of a sudden, my drug of choice was antibiotics, and it has been for the last 4 years. It's been a really awful time period in my life. And then that leads to depression, because you think there's something mentally wrong with you when it's not. It's all physical. And I feel like since being here, the first time when I sat down with Lauren on Dr. Prather, I cried, because I said, I said, you can really find out what's going on with me? I want my life back. I was swimming 5 miles, a mile every day at 5 o'clock in the morning. That's how active I've always been. I ride bike 10 miles, I travel, and my life had just stopped for the last 2 or 3 years, and I didn't know why. So I got in treatment based on those tests. Dr. Prather and Laura, they knew exactly what was wrong with me as soon as I got those tests back, and I started to get treatment, and I kid you not, I started feeling better in 24 hours. 24 hours. And now it's been, my 6th day on this treatment. For the internal problems I'm having, I still feel like a new person. And I know it's only going to get better. I'm still tired. I'm not back to what I used to be, but I don't even remember who that person was anymore. But I'm learning. I'm getting back. I rode 10 miles again last weekend, and I'm so much more effective at my job. It is the worst feeling to have to go to sleep at lunch to get through your work day, and then have to sleep for the weekend just to get through your work week. And my performance is so much better, and my focus is so much better. Everything in my life is different. I can hear the birds. I can feel things like I couldn't feel them before. I can hear things. I can sense things. I was just shut out of the world because I was so sick, and they knew exactly what it was and treated for it. It was amazing. I'm so thankful. I'm really thankful.
That's great. And it's cool to hear that you've only been doing this for 6 days.
6 days.
That's not even, it's just shy of a week. So just multiply that by 4, get you to a month, and that, I know. Just imagine.
I can't wait to,
Sure.
I can't wait to see where I am in 4 weeks, 4 months.
Sure.
In the year. I just can't wait.
That's great.
Yeah.
That's awesome. So for someone out there listening with a similar health issue who is thinking about coming into the Prather practice, what advice would you give them?
I would say keep an open mind. We're all so we've been trained and raised that Western medicine and seeing MDs is the right thing, and you know what, they're great, and they have their specialties, and they're wonderful, and I have some really good doctors, but I found that they weren't getting to the root of my issue, and I think we need to look outside the box, and we need to have an open mind when you come here, and know that the methods that are being used aren't voodoo. They're real. My husband thought it was voodoo at first, and now he's seeing the results, and he's amazed. It's not voodoo. It's real. These are real tests. These are real treatments. And let's go back. If you're biblical, you know anything about the Bible. In Leviticus it talks about using everything God has given us, and the treatment is all natural. It's their herbs and all natural, and that's what we're being treated with, not synthetic drugs. The other thing I would say is that I'm off of every single drug that I was on except one, and I was on 10.
Wow.
I'm off every single drug except one, because that's what was suggested to me, and I'm feeling so much better without them. So, keep an open mind. These treatments are real, and follow what you need to do, and you should be on your way. I think it really helped anybody that's struggling and has gone anywhere, everywhere, and then they've finally come here and found this practice, and like me, and you'll find, I think, the answer. I really do.
That's awesome. Well, Nancy, thank you for sharing your story, and it's really cool because your story is just beginning. So maybe we'll follow up with you here in a couple of months and see where you're at. So I appreciate for sharing, and we'll maybe talk in a couple months.
Great. In a couple months, I'm ready to lose that weight that I couldn't lose because of all the issues I had. So
then you come see me for weight loss, right?
That's right. Exactly. That's the next thing.
Perfect. Thank you.
Thank you.
The Prather Practice is located at 8902 North Meridian Street on the north side of Indianapolis, just south of the I-465 loop. If we can help you to achieve better health, we'd love to hear from you. Connect with our office at 317-848-8048. That's 317-848-8048. Join us again here next week or anytime on our website at thevoiceofhealthradio.com for The Voice of Health with Dr. Robert Prather. The Prather Plan weight loss program is safe, comprehensive, medically supervised, and designed just for you. Forget the trendy diets and instead start with a roadmap that actually resets your body's metabolism for optimal fat burning and increased energy. The Prather Plan has 6, 10, or 14-week programs with a proven record of success and with guaranteed weight loss. The Prather Plan is an individualized program that is tailored to your needs to create healthy new habits in your life. You'll receive support from a certified health counselor, a nutritionist, and an exercise physiologist for maximum results. Many weight loss programs can include unhealthy loss of muscle or organ weight. We target your ideal body fat percentage so you can lose body fat in a healthy way where the pounds stay off. Contact the Prather Practice today to schedule a consultation and create a healthier you. 317-848-8048 or on the web at thevoiceofhealthradio.com. The Prather Practice, restoring hope.